Hello, Teresa.
Hello, Doc.
You're gonna have to go over there. They had no clue, they had no talking down or anything. They wanted to do their.
When did I say forget it?
Teresa.
Hello, Doc.
Hello.
When did I say forget it?
Teresa.
Hello, Doc.
Hello.
When did I say forget it?
Teresa.
Hello.
I see 8 people present. Can we start the meeting?
Let me check it off here. Let's see, Whitney. Who's on the phone there?
Ronnie.
8 people present. Can we start the meeting?
Check it off here. Let's see, Whitney. Let's see. Who's on the phone there?
Ronnie.
8 people present. Can we start?
1 second. Okay.
Can we begin the meeting?
Just 1 second. I'm trying to get it back here. Something happened to my screen. Hang on just a second. Okay. Let me see. I got Troy. I was just trying to turn the volume down on the YouTube link so I could hear this meeting. Who is on the phone, the 749 number?
Ronnie Knox.
Ronnie Knox, okay. So 1, 2, 3, 4, 5, 6, 7. Yes, we do have a quorum, so we can get started.
Okay, is there any old business? We need to talk about anything old business or?
We just need to approve the minutes from the previous meeting.
All right, has everybody had a chance to review the previous meeting?
Yes.
Is there a motion to approve them?
I make a motion to approve the minutes as presented.
All right, that's, we don't need a second, that's automatic. So we can go on to new business, VIO 19 update.
Yes, I just wanted to give you guys an update because we've been working really hard here at the health department. We're a small team, but I always say we're small but mighty because we have many people doing many different jobs, and several people here on the board we work with just in their day jobs. So they've probably talked to us in different capacities, but we do work with the healthcare offices. We provide a PPE and hand sanitizer. We do a weekly Zoom meeting with all the healthcare provider offices in the county, as well as the nursing home. I've worked with James a lot on public information messaging and videos. We've worked with businesses on reopening guidelines, things like that. We've also got a partnership with Gravity Labs to provide more test kits in the community. So we've been giving those out to all the offices that want to participate. So the contact tracing hasn't been as big of an activity yet. We've only had one case that has recovered, but we feel like with things opening back up and different people getting out and getting more exposure, that we will end up having more to do with contact tracing as days go by. But we've had our time and our training. We're supposed to be getting help from the state level too, to help us with that. So just wanted to provide an update there. So anybody have any questions about that?
I would just like to say that I'm proud of the job that you've done, coming on when you did with the way things are and getting this dropped in your lap. You've done an excellent job. I'm proud of you.
Thank you very much. Thank you. I appreciate that. Okay. So we can move on.
You want to discuss the update any further, or are we all right?
I think we're okay to move on.
Okay, the next business is financial statements.
Okay. Copies of these were provided in your email or your packet. So we're in the black. It's a good thing. We're 136,668.96 actually is our balance, that when you take revenue minus expenses. So that's a good thing. And then our taxing district account balance is $530,210.87.
Any questions or comments? We don't need a motion to,
No. The next thing though, if you don't mind that I sneak in here, I didn't have on the agenda that I sent to you, but
all right, sure.
yes.
Go ahead.
Yeah, so we need to
Go
elect a
ahead.
chairperson and vice chairperson. So if anybody wants to start the nominations.
She put on, that's not in our agenda, that we need to elect a chairman and a vice chairman. Is there any motions?
Motion, we keep our chairman and vice chairman.
There's a motion that we keep to the chairman, vice chairman. That's Dr. Knott, and that's Teresa Kinser. Is there any other motion?
Second.
Second by Ronnie.
Say again?
We had a second by Ronnie Knox.
I didn't understand you.
We had a second by Ronnie Knox.
Oh, okay. Motion and a second. Is there any other motions or any other nominations?
Make the motion, we cease nominations.
All right. My nomination ceased. I'm sorry, what was the motion?
Made by Gary to keep you and Teresa as chair and vice chair.
Okay. Teresa, you have any problem with that?
Well, I'll need a raise. But other than that, no.
All right. Is there any other motions? All those in favor that the officers remain the same? All those in favor say aye.
Aye.
Any opposed? The motion carries. Okay, what's next?
Next, we'll talk about our budget and our program plans for fiscal year 2021. And a copy of the line item budget was in your email or your packet. The first thing we need to discuss that goes into the budget planning would be the pay increases. So you had a spreadsheet that showed costs for 2.5%, 3%, 4% and 5%. It's really not a true cost because we don't all get pay increases at the same time. We have annual increment dates, so those are spread out through the year, but that's the way we've always presented. That's really the best way there is to present what a salary increase would be. So if you have that Excel spreadsheet to see what the costs were, I could try to share my screen and share it if you guys would like to see it again, or does everybody have it in front of them?
Any comments or suggestions or feelings about it? How are we doing with our current balance and so on? How are we doing?
Yep. Right now we have, we're in the black, so that's good, 136,000. We still have 530,000 in the taxing district. And the budget that we have worked on and proposed for next fiscal year shows a surplus of 123,000 roughly.
Lacey, how many employees do we have that this would affect?
It would be 5 people. Because we have a contract, a couple others that are on contract, so there's 5 people that are actually true employees.
Do you remember what we did last year?
We didn't do anything last year, we did the year before.
And that was, do you remember?
I believe we got 5% the year before.
Okay.
Do you have any urge to ask us to change any of that? Do you requesting any change in that?
Well, I mean, I would say if there's any year that the employees would appreciate a raise, it would be in the time of a health pandemic. We're having to do a lot that we've never really had to do, and everybody's working hard. So I think that would be a good a time as any, you know, if we could do something, but that's totally up to you guys.
What
Well,
kind of a suggestion you have that we should change to?
So you said the last raise was 5%? That was 2 years ago?
Yes.
Well, I've worked with Stacy and Judy and Rusty, all of them closely. They deserve 5% because we ordered this up just special for Stacy, this pandemic, and she's earned it, and Rusty and Judy. And if we didn't give you anything last year, I think we should certainly do 5%.
Is that a motion?
Is that a motion?
That is a motion for a 5% increase.
Is there a second?
Second.
Okay, is there any urgent members to change that or alter that, or is that what the board exists steps? Now it's time to talk.
Do you need a second now? Is that what you're waiting on?
We have a motion and a second, and we're at that point where we need is there any comment? Is there anybody who feeling? Because now's the time to say it.
I call for a vote.
Okay, it's vote's been called for. Any other discussion? All those in favor say aye. Any opposed? Motion
Okay.
carries. I guess with the employees will like that.
Yes, it would be greatly appreciated. Thank you very much. So just a little more about the budget, because of everything that is going on with health departments right now, with the state legislature. We pretty much got the same allocations as last year, so it makes the budget that you have there easy. I mean, there's not a lot of changes. We've saved a little bit of money in this new budget because of hiring changes, but our allocations are pretty much the same, and we are able to keep our retirement contribution for one more year at the 49% level. And it's not going to go up to 84. So we've skated by one more year because of the pandemic. So just want to let you know about that. And this budget also takes into account the furlough Fridays. We're still doing those. So the hours will be Monday through Thursday, 8 to 5. So if you've had time to look at that budget over, you have any questions, we just need a motion to approve it.
Need a motion to what?
Approve the budget.
Okay. Is there a motion to approve the budget?
Motion to
I'll
So
make a
approve.
moved.
motion to approve the budget. Everybody's
Is there a
jumping at it.
second?
Second.
Okay.
Any other comment? All in favor, say aye.
Aye.
Anybody opposed? Motion carries. Okay, what do we have next?
Next is the local
local
health priority form.
We have local health that's kind of complicated to do. Do you want to explain that?
I will. So this is new in public health this year. It's the first time we've had to do it, but you probably heard Kathy talk about foundational public health and core public health. So in order to save costs, they really tried to get down to what health departments need to be doing, what's core public health, what's foundational. I'll see if I can share this picture. Hopefully you guys can see this. You see that picture?
Yeah.
Okay, so core public health makes up foundational, which is our epi response that we're doing right now with these communicable diseases. It includes Rusty's foundational with his enforcement of regulations, things like that. WIC and HANDS are right beside that, and harm reduction, so our syringe exchange program. All those things are core public health. So anything else we want to do as a health department now, we are calling those local health priorities, and I have to submit a form to the board for approval to do these programs. I sent you one, which was 809, the diabetes program. We've done that many years, which is our diabetes classes. I found out after I sent that there was a few other programs that we do that fall into that green box. So I filled out a form just like that on the breastfeeding peer counselor program. There's a grant that we get from Marshall University to have a diabetes coalition. We had to fill out one on that. And the other one was the Stay Well program, where we do the biometric screenings for the school employees to meet the requirements of their insurance. So these are all programs that we've done, and we get the funding from other sources. The only one that we do use local tax money, because we usually go over what the state gives us, is the diabetes program, and that's the document that you have in your packet. For example, I put in there last year they gave us 18,000 and we spent 27. So it takes a little more to get that program completed. I would only have to offer diabetes classes once a year, but we have chosen to do that twice a year, usually fall and spring. So that's the only one that we really use local money for. The other ones take care of themselves with either reimbursement or with the funds that they give us. So you only have 809, but I filled out the same form on some other cost centers. So I guess I would just probably need a motion because I'm afraid that I'll find more as this goes on. And rather than call a special meeting to approve a couple of these forms, I wondered if we could do a motion to approve local health priority forms for programs that the director feels are needed, or the director feels we have always done, or something to encompass this program so that we don't have to call a special meeting to get 2 more of these forms approved, if it comes to that, because we directors keep finding programs that fall under this.
I'd make the motion to give Stacy the authority to authorize 1809 forms for programs needed by the Powell County Health Department.
Is there a second?
Second.
Okay, is
Who's
there
second?
any problems we have if we just automatically do this? Will that work? I mean, I'm trying to say, this is a new environment. I'm
It
just
is.
trying to get used to this new environment. And is there any suggestions of anything else or any objection, any of the board members?
I just have a couple of questions. How is the participation with the diabetes classes? How many do you usually have for those?
I've usually been having about 7 to 10 in a class.
How many could you accommodate?
I had 17 one time. I think that was probably the most in a class. I could have more than that. I would just need to switch rooms at the extension office, because 17 filled up, quite a few in there, but we could have several.
When it comes around, I think we just need to try to be super creative in getting people there, because I've got at least 70 diabetics that need to come. And the hard thing is getting the information to them. So I don't know how to go about that, but we definitely have a huge population of diabetics in our county, and 95% of them are not controlled.
I want to,
Use your camera.
no, I can't.
Yeah,
I'm
I would
using
love to get more people in the classes too. So had a lot of interest for the one that was going to be in March, and then we didn't get to have it because of COVID-19. So
Yeah.
hopefully we'll get to start those back up and have a lot of participation.
So I have
but
one
we-
more question.
Uh-huh.
I wonder, this isn't my question, but I just had this thought. I wonder if somehow we could partner with Kroger. I wonder if we knew a pharmacist that worked at Kroger, Whitney. Because Kroger does a lot of great things. And I wonder if we could somehow partner with them to promote the diabetes education, diabetes classes, and, even going there to show them how to shop. That's a big thing. But it may be something that Whitney might be able to help us with.
Certainly.
And she might get some brownie points for doing that for Kroger too.
Yeah. Yeah, those are some things we talked about too with our diabetes coalition that we had just started forming because of that extra grant that we got for that. So we had some things like that. And they actually have curriculum out there, like shopping matters and cooking matters, that you can do with them. So
Yeah. So my other question was, with the breastfeeding peer counselor, does
Mhm.
that cost the patient anything to do that?
no.
Okay.
Nope,
I didn't
not at
think
all.
it did, but and I've referred a couple people just recently. But I think that's a huge resource, because a lot of women will start with breastfeeding. And it's first time something comes up and they panic and they stop doing it, and then they go get formula. So the more we can promote that, the better.
Yeah, I agree. And so I was kind of surprised that I had to fill out a form for that cost center, because it falls under WIC too. So I thought WIC would be core public health, but then that number of the cost center actually fell in this other column. So, but I do think it's needed. It's evidence-based that these peers really do help the moms to succeed. So.
Can I ask a question?
Yes.
What's the capital letters HLWD? DSMES stand for?
Okay. Healthy Living with Diabetes is the name that Kentucky gives to our diabetes program. And then DSMES is just the standard diabetes self-management, education, and support. So those are just,
Thank
yeah, terms they throw out all the time in public health, sorry.
All right. Do we have
I went over to Joe Beast to pick up a piece of Cerebellum. Well, now they probably don't have it anyway. I've already sent them an email saying, well, my son went over there, but they still have an order in, so just get it. He's gonna go ballistic. I'm gonna put it over.
Okay, do we need to vote on this?
Yeah, we do. And if there's a problem with that and I do need to come back and get approval on each one, we'll do that. I was just trying to save a special call meeting if that would work, since it is so new.
All those in favor say aye.
Aye.
Any opposed? No. So carried. Now, what do we do next?
Next is the taxing district budget for 2020, 2021. So you did get a copy. And what I would be asking for in the budget that you approved is the same as last year. The $425,000 be appropriated to the health department for operations.
So we need a motion to approve the budget as of last year. Is that correct?
Well, you would need to make a motion to give the health department $425,000 from the taxing district for operations for next year.
Okay.
I make the motion that we appropriate $420,000 to the health department for taxing district for 2021.
All right. Is there- Okay, is there any discussion? All those in favor say aye.
Aye.
Any opposed? Okay. Public health tax rate, we're leaving that the same, is that correct?
That would be my suggestion based on our finances and our retirement.
We don't need to pass a motion for that, do we?
Yeah, I actually do. I got to pass one. I need a separate one on all three, a motion and a second, and it'll just be to maintain at 8% for all three of those.
Okay. Is there a motion? Have you made the motion? You can't make a motion, can you?
The first one be for the public health tax rate.
Motion to leave it at 8%.
Okay.
I'll second it.
Okay.
Okay, Ronnie seconds.
We have a motion.
And
We
a
have a
second.
motion and a second.
Mhm.
All those in favor say aye.
Aye.
Any opposed? Okay, is the tax rates for vehicle and watercraft is remaining the same? Or you have a recommendation?
I think it would be fine to leave it 8%.
Okay. All those in favor say aye.
Well, we need a
All
motion and a
right, we
second.
gotta have a motion to leave the same.
I'm sorry. I jumped
It's okay.
ahead, didn't I?
So we got a motion.
Okay.
It's okay.
Who gave the motion? Teresa?
Mhm.
Me.
I'll second it.
And okay, the tax rates to stay the same.
Mhm.
All in favor, say aye.
Aye.
Any opposed? Okay, optional tax rates for tangible property. I assume that'll say, is our motion to keep that?
I move we do.
Second. Second,
Second.
okay. All those in favor say aye.
Aye.
Any opposed? Any other business?
There's one more thing. So Troy, you have to say bye to you now so we can take care of this last matter.
Bye, everybody.
I'll explain how this is gonna go. Okay, so I'll reflect in the minutes that Troy Brooks left the meeting at this time. We don't actually have to go into closed session unless you all want to have a discussion more in depth. Just let me know. Somebody make the motion to go into closed session and I can stop the live stream, but we were given that option. I'll just explain what it is. We had told you recently in a meeting that I wrote and we received a opioid response grant. It's called Overdose to Action, and it's $170,000 grant a year for 3 years. So it's a big project and I wanted to try to continue to manage that even with the promotion to director, but with the pandemic, it's just not possible for me to also work on the grant. And it is a CDC grant that really needs to move forward. It's got a lot of good activities and things for the community. So it was recommended for me to hire some temporary help to manage the grant and work with me on this. So I ran the advertisements, and at the end of the window, I had 2 applicants, and they were Dina and Nathan Brooks. So they are Troy's wife and son. And I can see where both of them would have good skills that would help us on this grant. So it's cheaper to hire 2 part-time people with no benefits on a contract than it is to hire a full-time person. So if they're both willing to help with this temporarily until this pandemic settles down, then I wanted to do that. But because they're related to a board member, I had to seek guidance on how to get this properly approved. So the first thing I had to do was write a letter to the commissioner and get written approval from the cabinet of Health and Family Services. So I wrote a letter to Dr. Stack and sent that in, explained the situation, what their job duties would be, how I advertised for the position. They were the only 2 applicants, and why I thought that it would be in the public's interest to let them work on the grant. So Dr. Stack did approve for me to hire those individuals. I got that in writing on May 15th. So the second step is that the board has to approve, and that the member that's in conflict can't be at the meeting, can't vote on it. So I've gotten the cabinet approval. So if it's okay with the board, I would like, you all can discuss this. If you want to go in a closed session, we can, but I just need to have it approved and voted on to hire these 2 for temporary help on the grant.
I'll make the motion.
I'll make a motion,
And
we
they might
we
lie.
hire them.
I hate to say this, but you couldn't pick a better bunch, okay?
And that's what I think too. So I'm glad that they're willing to help me, and I feel like I can trust them to do a great job. So.
All right. Any other comments?
I have a question.
Okay.
Okay.
Are we gonna get any testing in the near future here in Powell County?
Say that again.
Are we gonna get any testing in the near future here in Powell County for this flu?
We have testing at all the healthcare offices. They have their own ways they do those testing, but every office is capable of testing. We might have a drive-through pretty soon that'll be run by one of the clinics, but we don't have all the details worked out on that.
Okay.
But every office does have them, so there's definitely the capacity for that.
Oh, okay.
I got a
Any
motion
other
from James on the hiring. I didn't get a second written down.
I'll second that.
Teresa. And then I guess
Or
a vote.
Ronnie.
Okay.
And so do we pass the motion? Or do we need to pass it again?
We need to vote.
Yeah.
I'm sorry.
Ready to vote. We're ready to call for a vote.
All right, it's up for a vote. All those in favor say aye.
Aye.
Any opposed? Thank you. Anything else?
That's all I have. The next meeting date would tentatively be, usually we do September for the fall meeting. So that would be September 15th, unless I need to call a special meeting for anything related to the budget as we finish up that process here.
So that's it?
Yep, just need a motion to adjourn and second it.
I'll make a motion to adjourn.
You need to punish me a little bit. I'm a little sluggish. Okay. There is a motion to adjourn. Thank you all so much. This is wonderful. And
I'll second.
Okay.
I'll be a little smarter next time. All those in favor say aye.
Bye.
Any opposed? Thank you, boys and girls. Okay. Appreciate
Thank
you.
you all. I appreciate it.
Thank you.